Good evening to some of you. Good morning, good afternoon to others. It's wonderful to be together. These Friday Zooms present us with a special opportunity to have international guests join us sometimes. And today we are so honored and excited to have Dr. Kelly Mattone. This woman is so knowledgeable about our liquid collagen and has just a very powerful story and insights that she's going to share with us. But on a personal note, when I first met her, we by happenstance were sitting side by side at the very first event that she ever attended, and it was just, soul sisters from the beginning. Let me tell you just a little bit about her from a professional standpoint so that you can know the credentials and the background that she brings. Dr. Kelly Mattone graduated summa cum laude from California State University in Los Angeles in 1985 and was a gross anatomy teaching assistant for 3 years while earning her medical degree at the Mount Sinai School of Medicine in New York. After completing her residency there and as serving as chief resident in physical medicine, Dr. Mattone continued at Mount Sinai Hospital as an attending physician, clinical residency instructor, and associate professor of gross anatomy, teaching at the very medical school that she had attended. She holds a board certification in physical medicine, rehabilitation, and subspecialized in spine and sports medicine rehab, and built a very successful career and has worked on many of the New York Jets football players. Dr. Mattone transformed the scope of her practice from therapeutic to aesthetic in the year 2000 and is a leading cosmetic physician specializing in non-surgical procedures for the face and the body. So Dr. Mattone's unique qualifications and her inside out approach to both health and beauty put her on the cutting edge of cosmetic medicine and also on OSMA's radar. Dr. Mattone was appointed to the prestigious Scientific Advisory Board of Modere in 2017. She's a strong advocate for and embodies the core values of the company. On a personal note, Dr. Mattone is a single mother of 4, 2 of whom have joined her in Modere. So please help me welcome Dr. Kelly Mattone. Thank you so much for being with us, darling. And if you want to jump in, why don't you start by just sharing your story? How did you happen upon our liquid BioCell? And
I will. And you know what? Every one of us has a story, and it's so important when you're in the business and in personal life to lead with your stories and make personal connections. And my story is unique to me. And here it is. I had a patient come in for a consult, new patient, and we're talking. And the next thing I know, she's saying to me, "Hey, would you be interested in a new line of skincare products?" And I said, "Are you an undercover rep disguised as a new patient? Because that doesn't sit well with me. I don't just see reps, I have my own product line. I don't want another product line, and I don't take this lightly." She goes, no, but you don't understand. This is the best product in the world. And I said, I'm not interested in that. And now I'm a little bit offended. And she said, "All right, maybe my English isn't so good and you don't quite understand. Would you mind next week when I come back, when you treat me, if my friend comes who's a doctor in the States and she can explain it to you?" And I said, "Okay, you know what? Your friend has 5 minutes, and when I'm injecting you, and then we're done." So Dr. Virginia Pajunen, who's high up in Modere in the US, comes in with her little computer, and she tells me 3 vital facts: that this product increases your hyaluronic acid by 6,000% in 28 days, that the enzyme that breaks down hyaluronic acid is stopped in 28 days, and all forms of collagen are increased and made brand new in 28 days. And I said, "Time out." And she said, no, I have 4 more minutes. And I said, "I don't need 4 more minutes. I'm in. You have me." I said, "I'm a scientist. You have just spoken a basic language to me." And I said, "As a matter of fact, I'm going to be on the scientific advisory board of that company." And she looked at me like I was crazy. Like, you don't know anything about it. I said, "I know the science, and that's all I need to know." Fast forward, that was in 2013. In 2015, I was with Osmo long before we merged with Modere. We were Jusuro, and she appointed me to the board then. It didn't become official until I met Margie in 2017 when we merged, and it's just been incredible. And so in this business, you'll find, and in life, people either get it or they don't get it. And if they don't get it, let them go on, because eventually they will, and speak to the people that do get it, because it's simple. And when I want to talk to you today, it's going to be in simple language that you can understand and you can go and share with other people, because you have such power in your hands to help yourself, to help others feel better, accomplish more, and just feel better about themselves and how they look and how they feel. So thank you for the opportunity.
Honey, I love that story, but I have 4 more minutes. I don't need it. You got me. You had me at hyaluronic.
And hello.
You had me at hello. Thank you so much for sharing that story. I love hearing it every single time. Why don't we start? Because there are people that are very knowledgeable about collagen on the line, tuning in, but there are also people that might not know much at all. So why don't you start by just, and this is one of the things I love about the way you teach. You do teach in simple layman's terms. Just start by explaining a little bit about collagen and hyaluronic acid. Just give us a baseline.
Okay, and you know, if it's redundant for other people, but here it is. Collagen and hyaluronic acid are what make up our entire body. You know, collagen is a very strong, rigid protein. It makes up 90% of our body. Hyaluronic acid is our body's sponge that absorbs water, but it doesn't just absorb massive amounts of water. And the massive amount is 1/4 teaspoon of hyaluronic acid absorbs 1.5 gallons of water. That's huge. Collagen by itself is a very rigid, dry molecule. And it has to be, because it has to support us. But we also have to bend and flex, and we have to be resilient to compression. And that's where hyaluronic acid comes in. Collagen by itself is like a grain of uncooked rice. It's hard. It's not a meal. You can't do anything with it. When you add water to the rice, it becomes something different. Hyaluronic acid is what collagen does to collagen, what a pot of boiling water will do to your rice. It makes it soft and flexible, but still maintaining its shape and the strength that it has and the resilience. So that's what makes us, and that's what's unique about the collagen that we have, because they coexist together. It's called a matrix, and only Mother Nature can make this matrix. It's a special design that when collagen and hyaluronic acid come together, they can't be separated ever, unless the hyaluronic acid dries out, just like our bodies. We're made of collagen and hyaluronic acid. Our skin is plump. Our joints are lubricated. That fluid between your joints is hyaluronic acid. It's called synovial fluid, but it's hyaluronic acid. The ends of your joints are made of cartilage and connective tissue, and that's collagen and hyaluronic acid. They exist together. And when the hyaluronic acid dries out, collagen becomes brittle, and bones rub against each other, and your skin kind of buckles because it doesn't have the turgor that the water of hyaluronic acid gives it. So is that,
yes, it's fascinating.
That analogy and bring it to real life?
I love that analogy. And rice is a good analogy in India, isn't it, guys? Right?
Yes, and I had to modify my talk, because in the States I use pasta. Everyone knows about pasta, but it's the same concept. It's exactly the same concept. And that's what happens to our bodies. We dry out over time. And Margie, we're going to talk about this later on, but I think it's important to bring it up now. Scientific studies have proven, there was a study that came out in January of 2023 in the British medical journal, The Lancet, very respected journal. There was a study done over 25 years on the hydration levels of individuals. For 25 years, that's a very long time. What they found was adults who are not hydrated enough have a 50% more increased likelihood of having visible signs of aging, lines, wrinkles, dryness, joint issues, a 50% increase in physiological aging. That's pre-disease that you don't see yet. Your arteries starting to harden, your heart starting, things not working well inside. And get this, a 20% increased risk of premature death. And that's from not being hydrated enough. And when you hear the term not being hydrated enough or hydrated, you need to think hyaluronic acid, because
probably most people think water, right?
Yes, but you know what? Hydration is the water you keep, not the water you drink. And the
Right,
only way to
right.
keep water is with hyaluronic acid. So let me explain how you can be dehydrated while drinking a gallon of water. If you don't have hyaluronic acid to absorb the water that you take in, where is it going? Your body is going to fast track it to your bladder. You're going to pee it out, excuse my language. And you can be dehydrated because you don't have the sponge of hyaluronic acid to maintain that in your body. And once hyaluronic acid takes that water, that's exactly how water exists. And you know that we start out as 90% water and we wound up at about 50% water when we die. And that's because we're losing hyaluronic acid naturally. And that's another subject we'll get into about how we naturally lose hyaluronic acid and collagen. But I hope that that
Yes,
theory
it
makes
does.
sense as well.
It does. It does. And I think one of the things, I mean, obviously, we know that there's not a collagen on the market that compares. But aside from the fact that we've got a type 2 collagen, a highly bioavailable collagen, the next best thing about our collagen is that it's not just collagen. And the thing that continues to blow me away about this formula is the synergy. And I love how clearly you explained that and the power of hyaluronic acid. If you didn't write it down, I'm going to encourage you to write it down. It's not the water we drink, it's the water we retain, right? You guys,
Yes. Hydration is the water you keep, not the water you drink. And where and how you keep it determines how you age.
Wow. So that's some great stuff right there. Hey, and why don't so while we're talking about aging,
Margie, can I just
yeah.
give two extremes examples of populations of people that show what a hyaluronic acid level does to aging?
Yes, please.
Okay,
Yeah.
so there's a disease in children called progeria. These children age exponentially. They go through the same aging process we naturally do, except by the time they're 12 to 15, they're already dead, looking like shriveled up little old people. And would it surprise you to know that the hyaluronic acid levels are 17 times higher in their urine, meaning that they're losing hyaluronic acid at such an accelerated rate that their body, no matter what is causing this problem, is dehydrating them and losing.
Whoa.
And then on the other extreme is a village in Zukuri-Hara, Japan, called the Village of Long Life. These people have 10 times more residents over the age of 85 than any city in the US and 900 villages in Japan. And what happens with them is that their hyaluronic acid levels never, ever decrease because of where they are in the foods that they eat and what else it does with their hyaluronic acid levels. But again, these people are 90 years old and they look like they're 40 or 50. They don't age. Their hair hasn't changed color. Their eyesight hasn't changed. And so there's the extreme of what hyaluronic acid levels can do.
It's absolutely fascinating. And the synergy of those ingredients working side by side. I mean, it's amazing. We have nature's greatest miracle right here. And I love how you also shared, it's not just about the visible signs of aging. You also said it's what's happening on the inside to your arteries, your vascular system, all of these things, every
your
step,
gut, everything.
Yes, your gut. And
I mean, I can share a personal story about what happened with my joints if you'd like to, because that's another one of my stories and how I met it. Okay, and it was divine intervention that I found out about liquid BioCell in late November of 2013. In 2014, I had an accident where I tore all the ligaments in my hips, and I can't tell you the amount of discomfort I was in. It was just horrific. And I called up Dr. Brzezinski, who had introduced me to the product. She had spoken to me more about the skin and beauty aspects, but I knew they were joint things. And I said to her, my joints are just, I can't take it anymore. And she said, drink a bottle in a day and let me know how you feel. And I knew that was a safe thing to do because there was no toxicity. It's like you can't OD on chicken soup and fruit, right? So within 48 hours, I would say about 65% of what I was feeling was off the table. I mean, the other 35% was just horrific, but I said, okay, I mean, it gave me hope. And I kept taking and I was feeling better, not great, but still I could manage to get up. I have 4 children. I have to work. I have a solo private practice. I have no time for being down. And so about 2 or 3 months later, I said, I'm going to stop it. I'm a scientist. I need to see, normally our bodies heal itself within 6 to 8 weeks. And I know that from my sports practice, and that's kind of general knowledge. I stopped taking it and I didn't tell anybody, and I was not feeling good at all. And one of my assistants said to me, Doc, what's wrong with you? She goes, you can't get up and out of your chair anymore like you used to. And I said, I stopped liquid BioCell. And she looked at me, she goes, why would you stop that? I said, well, I'm a scientist, I wanted to see. I said, I promise I'll never stop it again. She said, you better not. Why would I ever stop it again? Except scientists use double-blinded placebo-controlled trials. I was my own. I kept taking it, was feeling better, and I stopped it again and didn't tell anyone. My esthetician in my office said to me, oh my goodness, you're limping, and what's wrong with you? And my secretary said to me, I bet you stopped liquid BioCell, didn't you? And I said, I did. And she looked at me incredulously, how could you do that? I said, I'm a scientist. I was double blind, but now I see I will never, ever stop liquid BioCell. It's been 10 years, and I'm just grateful for what it did for my life. And at the same time, I wound up having to have my hips operated on, and I have total hip replacements. I was out of work for a month, and a young junior member of the team came to me and said, Doc, did you make any money while you were out? And I said, no, not at all. And he said, well, I quit my wait staff job, and now I do Modere full time. And you might want to think about doing this as a full-time, or as a better supplement. And we should all have multiple streams of income, because you never know when your primary source of income is going to be taken away, along with your ability to go and make money and to be a mother and to be a person, and then to feel and look like the world's just coming down around you. So this company, this product, just supports every pillar of every aspect of my life. And I could not be more grateful to Ozma for creating this product and allowing us to have the opportunity to help ourselves and other people.
I got to jump in on this and say that it's such an honor that we have an offering like this liquid BioCell, the collagen HA matrix, that we can attract medical professionals across the globe. Literally, there are thousands upon thousands of healthcare practitioners in all disciplines that have recognized the value of this product, and they can't not share. Once you have this information, you want to share it with everyone that can benefit from it, which is everyone. And so it becomes like a moral imperative for these practitioners to share. And how amazing that the compensation structure associated with this product compensates them. Because truth be told, even with the income that many doctors and healthcare practitioners make, even with that great income, they can only do one operation at a time. They can only see one patient at a time. So to be able to create that leveraged income while knowing you're doing something good for the world is incredible. So I just had to piggyback what you were saying there.
Yeah, absolutely.
I want to jump back though a little bit to the enzyme hyaluronidase. What impact does that have, and how is our liquid collagen unique in that regard? What is hyaluronidase compared to hyaluronic acid, and what does it do? Yeah, if you would.
Okay. Hyaluronidase is an enzyme, and the job of enzymes in our body, and they're necessary, is to break things down. And every substance has an enzyme that will break it down. Hyaluronic acid's enzyme, or arch nemesis, is called hyaluronidase. And this just breaks down hyaluronic acid naturally. Those levels never change. Hyaluronidase just keeps chewing up your hyaluronic acid, and your levels just keep going down and down. And this starts at birth. You have more hyaluronic acid in you when you are in the womb than you do when you come out. You're 100% hyaluronic acid in the womb. The minute you come out, you're 90%. And do you know that by the time you are 1 year old, you're already down to 80%? That means hyaluronic acid levels drop because hyaluronidase breaks it down. hyaluronidase doesn't, that's the enzyme that makes you age when you think about it. So there really is, it's not a myth. There is an enzyme that makes you age, and it's called hyaluronidase because it breaks down hyaluronic acid. And you've learned, scientific studies have shown you that losing hyaluronic acid causes you to age internally, externally, and premature death. And hyaluronidase is that enzyme that does it naturally without outside interference from the sun and everything else that chews up your collagen and hyaluronic acid. So imagine if there was a pill that you could take that would stop that enzyme. I bet everyone in the world would take it, right? But it doesn't exist. You want to know why it doesn't exist? Because the FDA in the States cannot make that. It's a natural substance that only Mother Nature can make and can only be found in nature. So the pharmaceutical companies cannot make something that Mother Nature makes and put a label on it. That's why we're a supplement. And also, if the pharmaceutical companies made it, they would put it in a powder, a pill, or a capsule. And you know what that's worth? About 5 to 15% of what you spent and what you take, because powders, pills, and capsules, scientifically proven, are absorbed at a rate of 5 to 15%. That means that for every $100 you spend on a powder, pill, or capsule, especially if it's a collagen powder, pill, or capsule, you are losing $85 to $95 that you spent, and you are not absorbing 85 to 95% of what you're taking. And then it goes into the marine system and it destroys our fish. Okay, so that's why our form of being in a liquid is huge, because liquids are absorbed at a rate of 90%, no matter if it's a pharmaceutical or if it's a supplement. And the processing that liquid BioCell goes through, our patents are based on the process, not on the contents. Most patents are based on the ingredients that are put together. Our 7 US and international patents are based on how this liquid BioCell is processed from its raw form. And that is absorbable at 98% right in your mouth, just like nitroglycerin is absorbed in your mouth. You're going to hear pushback from people that say, oh my goodness, hyaluronic acid and collagen cannot be absorbed, first of all, in the mouth. And once they get into your gut, they're too big and the acids will just destroy them. And you have scientific proof that shows that 98% absorbed in the mouth. We process it down to the exact molecular weight, the exact size. It just goes right through the lining inside your mouth, which is why you take it. You should just kind of keep it in there for about 20 seconds or so. Say your prayers, do a little meditation, do something. You'll be absorbing even more. So those are little interesting fun facts, aren't they?
I think so. And I think
I love fun facts.
you know, where essentially what you've described with hyaluronic acid and hyaluronidase is a revolving door, right? And the fact that this product can interrupt that revolving door. I mean, say just a little bit more about that. I'm not sure if everyone really caught that fact, that not only are you getting 6,000% increase in hyaluronic acid in 28 days, but this liquid collagen literally blocks the enzyme hyaluronidase that would then go and break it down. So no more revolving door. I mean, say it, you can say it better than me.
Okay, so if you, liquid BioCell actually inhibits, and I have a slide later on, I can show you the scientific graph, literally within 28 days, hyaluronidase becomes less effective and less effective and less effective until it has no effect at all. And that means your hyaluronic acid levels can just soar. And also now they're going to soar on their own because hyaluronidase has stopped it. But now you're ingesting 6,000% more. So you're really going up, I don't know, 20,000. It's just incredible, the amount. Their scientific studies also show that in 12 weeks, 76% of dryness is eliminated. There's a bar graph that shows this is your dryness, and this little one here is your dryness. In 12 weeks. I have pictures of, hopefully we'll get to see some of my before and after pictures.
Yeah, let's do it.
Of women with dry skin and that just is so glowy and healthy. And if that's what you look like on the outside, imagine what your inside.
Yes, yeah.
Can I say two other things about what hyaluronidase does to you? These are very interesting facts that, you know, it kind of makes you a little interesting at parties or whatever, but hyaluronidase breaks down hyaluronic acid. Do you know that snake bites can kill you in an instant, right? Bee stings can kill you in an instant. A virus can kill you in an instant. And the reason why they can do that is because all of these organisms secrete hyaluronidase, and they break down your hyaluronic acid in your connective tissue, which makes up 90% of your body. That is your entire infrastructure, can collapse, boom, in an instant when hyaluronidase breaks down hyaluronic acid. The connective tissue in our body allows for cells to migrate. That's what hyaluronic acid does. It's a waterway for everything that needs to go on and for cells to communicate. And when you break that down, everything is broken. It's like a power grid across the whole country.
Wow, that is fascinating. I've never heard it explained quite like that, but I love it. Yeah, let's take a look at some of these before and afters now. I'm going to go on mute for just a second.
Okay, so this is a slide that shows that hyaluronidase is inhibited in 28 days. You see how it starts out tall bar graph, and in 28 days, it's practically non-existent. Okay, this shows the 6,000% increase in hyaluronic acid in 28 days of taking a half an ounce in the morning and a half an ounce at night. And you want to, you cannot take a double dose in the morning and think it's going to work. There's a half-life of hyaluronic acid, and it's 12 hours. And that's why we ask you to take it 12 hours apart. And I always tell people, associate it with brushing your teeth. I brush my teeth twice a day. I don't like to put anything in my mouth before or after I brush my teeth. So I always, when I put that toothbrush up, I go, oh, not that I really need to be remembered, but that's what I tell people. So you will take it twice a day. This is a dryness scale I was telling you about. In 12 weeks, dryness is nearly eliminated. And you'll see a couple of pictures later on that will show you that. This is physical activity that shows within 8 weeks, you have a nearly 40% increase mobility and a decrease in physical discomfort based on a placebo. There is no medical drug that a doctor can give you that's going to give you those results, plain and simple. And doctor-given pharmaceutical drugs are going to cause you more problems than good. So this shows, and I'm living proof, and so are millions of other people around the world, that this really, liquid BioCell really does increase your ability to have physical more activities and less discomfort. This is all brand new types of collagen being made, especially collagen type 2. That there's two types of collagen in your body. One is type 1, and that's in your connective tissue, that's in your skin, that's in most of your body. Collagen type 2 is in your joints, in your spine, and in your eyes. And that's what liquid BioCell is. It's collagen type 2 that's from a natural single source. And it is the exact same composition. When our brain sees this in our body, it says, well, I must have made it myself because it's exactly what I make. And that's why it increases. But it also is called bioactive because liquid BioCell stimulates chondrocytes. Chondrocytes are the cells that make collagen. And liquid BioCell stimulates chondrocytes to make brand new collagen. And that's where the pink graph comes in. So brand new collagen, no other collagen on the market can do that. And I strongly suggest never ever for bovine collagen and marine collagen, just out of the question. Next one. Okay, look at this woman. In 2019, she was 89 years old, and she looks it. In 2021, 2 years later, she's 91 years old. And in 2022, the last picture, she's 92 years old. She should be aging the other way. If this is
aging backwards,
if that aging in reverse is no myth, then here's the proof. I have a teaspoon twice a day. Look what it does. And if it could work on people this age, imagine what it does. So in my practice, my practice is based on prejuvenation. If you can, like the people in Sakura, Japan, never decrease your hyaluronic acid levels, you should never really age. My daughter is my little scientific experiment. She has been on this product since she's about 24 years old. She's 31 and people ask her if she's 22 because her she's at the prime age. Your hyaluronic acid and collagen levels start to drop at about 25, 30 years old naturally, in addition to the hyaluronidase and external factors making your collagen and hyaluronic acid levels break down. My daughter has never done that. Normal aging starts at 25, 30. That's when you start to see lines and wrinkles and spots and not feeling so great. So I always recommend you start this if you can before you even start to naturally lose your collagen and hyaluronic acid. But it also, on the extreme spectrum, you never, ever too late. And I can tell you stories of, I've given my patients the product and they've given it to their elderly parents who tell them to take their walker and their canes because they don't need them anymore. And these are real life stories. Let's see the next patient. Okay, this is a gentleman on the left. And if you can see within 3 weeks, the depth of the wrinkles on his forehead. And if I don't know if you can see it, but on the top picture, you could see individual hairs in his head. And if you look in the bottom picture, I know the exposure is a little bit different, so the color will be different, but the amount of hair he has is significantly improved within 3 weeks. Our clinical trials were based on 3 months. And so we ask you to try the product yourself for 3 months and encourage others to give it at least 3 months to see results. But I'm going to show you people from 5 days to 3 weeks to 3 months of seeing results. Okay. The woman on the end, 76 years old. Look at how dry and dehydrated she is. And the other picture on the right just shows her 6 weeks later how hydrated she is. Every one of them on the right side, their after pictures, either after 6 weeks or 3 months, look incredible. What else you got there? Okay, look at the hairline of the woman on the right side. There's a beauty mark that I don't know if you can see, but it's outside of her hairline. 3 months later, that same beauty mark is now inside of her hairline after taking liquid BioCell and liquid BioCell only. The picture on the right is before and after very aged, sun-damaged skin. And that's her after 3 weeks. She's about a 68-year-old woman. And that's after 3 months, I'm sorry. The picture on the left of the young woman with the neck is also a Modere social marketer, and was surprised. She had no idea that what this would do. And she was just snapping selfies, and that's what she saw. And then the woman on the right, the mouth lines, I mean, people pay me a lot of money to inject these lines away. And the first thing I do when I have a consult with people is to explain to them the way I explained to you how we age and what you need to do. We age from the inside out and from the outside in. But if you don't address aging from where it starts and the root cause is a loss of collagen and hyaluronic acid, then how do you ever expect anything to happen from the outside in? And I tell people, if your doctor is only treating you from the outside in, you are half treated at full or double the price. So aging starts from the inside. You need to attack it from the inside out and then from the outside in. What do you got next? Okay. These are all people that didn't think that they were going to get any results and didn't even see them until they saw the before and after picture. So I strongly encourage you and anyone else that you share this with to take before pictures. People will tell you, oh, I know exactly. No, they don't, because people look at these pictures and you look at these pictures and go, wow, what a difference. And when these individuals look at those pictures, they go, no, I really don't. That until they looked at the picture, didn't see in the mirror that there was a difference, because they always view themselves in a different light. So please take pictures, and take pictures with bright lights, without makeup, straight expressions, with smiles, but mainly straight. Take pictures of hands and knees and elbows, because they're all going to change without you even realizing it. Okay, so this just shows you that liquid BioCell collagen has the exact same composition as human articular cartilage, and our body, our brain knows that. And our brain also knows that if you are taking a powdered collagen, it doesn't have hyaluronic acid and it doesn't have the abilities that liquid BioCell does. And so that's scientific proof that we have the same composition. These are all just the scientific facts of what those graphs have just shown you, that liquid BioCell is really just the most unique collagen hyaluronic acid matrix, singly sourced, widely studied, with clinical trials endorsed by doctors like myself. We have Olympic athletes. We're NSF certified for sport. So Olympic athletes can be on this, professional athletes can be on this, amateur athletes can be on this. We have pet and equine versions of this as well. It's safe and it's effective, and it's changed my life.
That's beautiful, honey. And I love seeing some new before and after pictures.
Right?
It was really, really impressive.
And I just want to say one more thing, and it's
Yeah,
important
please.
that you say, that everyone says this. Our product is not intended to diagnose, treat, cure, or prevent any disease process. That doesn't mean that if you have a disease that you can't take it. It's a natural product. And we always encourage everyone to go and talk to their doctor if they have medical issues that they're concerned with. But as far as we're concerned, it is a safe, natural product, but not intended to diagnose, treat, cure, or prevent any disease.
So we're just a little past the top of the hour right now, but maybe what we could do is, and let's start right there. One of the things a lot of people will say is, I'm taking this pharmaceutical drug, or I've got this condition or that, or, whatever. And of course, we don't diagnose, speak with your healthcare practitioner, find what they say. But one thing that is true is that every compound in the liquid collagen, your body makes them. And because of the bioavailability, the mirror matching of the molecular structure, your body can just take them right up. Like these are compounds, your body knows what to do with these. So maybe that let's put that question out first. Is this a safe product? Are there contraindications? I think that's a commonly asked question. Let's start there. And then let me, excuse me, let me say this. As you're listening, if you have any questions you want to ask, please enter them in the chat or get ready to pop off mute, and we'll ask Dr. Kelly a couple questions before we let her go today. Dr. Kelly.
Number one, 100% safe, all natural product. It's made in nature, and it's 100% safe. If you have any concerns or any medical issues, again, strongly advise you speak with your doctor about it. And I'm sure that they would give you their okay if they deem it possible for you.
Yeah, great. Does anyone else have questions? Let me just look down here at the chat, see if there are any there.
I have a question that comes up often for people who forget their second dose. Is it okay to double dose and take that
Sure.
maybe once a day? Okay.
Absolutely. Yes, but don't make a habit of that. But absolutely, you could. As I said, it's no toxicity, 33 times normal intake. So yes.
So is the power of the half-life the 12-hour difference? Is that ideal?
Yes, somewhere between 10 and 12 hours, because half-lives go up and then they go down. So somewhere 10 to 12 hours. Better to take it a little bit early than not to take it at all. And if you think it's too late, it's never too late. And you can never do much. And what I encourage people too is, since it's dose dependent, you saw those studies that it takes 28 days to reach those levels. If you double or triple your intake when you first start taking it, science kind of shows that you may see results quicker than if you don't. So if you can afford it, that's what I usually recommend to people.
Great, thank you.
I have another one for you.
Sure.
So when if somebody is pre or post surgery, why would it be important for them to double up on this product?
Okay, you know what? I have a surgical story. My doctor asked me to stop taking it beforehand on one of my hip surgeries, and I listened to him. I knew better that I shouldn't have, but I wanted to stop it in case there was a problem. He would say to me, because he said, "Oh, that stuff that you're taking," like the stuff that saved my world.
Saved your life. That stuff.
So I didn't take it. I had a problem with that hip right from day one, and that hip got reoperated on. 3 months later, I had my other hip operated on, and I took liquid BioCell right up until the midnight hour, and started again right in the recovery room. And I've never had any problems with this hip. But again, this is something you need to discuss with your doctor. If you're having surgery, your doctor needs to know every pharmaceutical drug you're on and every supplement you're on. Just because it's natural and with other herbal supplements, your doctor should know what you're on. And even with liquid BioCell, come clean, because you know what? You might just educate your doctor on something that they don't know.
I always, that's it.
But don't be pushy. don't be pushy about that.
Yeah,
You know,
yeah.
don't push your healthcare professionals. We don't take kindly to that, but feel free to share your story and share my story. You can share my story.
Here's a question for you from Tarun. He says, liquid BioCell, is it safe for cardiac patients who have gone through angioplasty?
Actually, it's beneficial. You know, most people who have cardiac issues will take the supplement chondroitin sulfate. And in the 70s, there were studies done on chondroitin sulfate that showed that it was so beneficial to cardiac patients. But the health industry, the FDA, did not want to hear that because they could not market that as a drug. Okay. And so, yes, it is so safe for cardiac patients to take because we're part of chondroitin sulfate. Collagen, hyaluronic acid, chondroitin sulfate are all part of that matrix. You can't separate them even if you tried. And so you don't have, if you're taking glucosamine supplements, I'm just going to do a little aside. Hyaluronic acid is 2 sugar molecules put together. One of those sugar molecules is called glucosamine. That's also another supplement that people take when their joints bother them. And so we already have that. So if you run across people who say, oh, well, I don't want your product because I take chondroitin sulfate and I take glucosamine, you can say, well, you're missing the collagen and the hyaluronic acid that they normally naturally occur with. And if you drink a half an ounce of this twice a day, you don't need to take all those pills and capsules that you're not going to absorb anyway.
Right. Good point. Good point. I want to just add that this product impacts all of the soft tissue, all of the organs. This is, to my knowledge, it's one of the only compounds that can heal leaky gut. And everybody, as a result of our eating, you know, a lot of carbohydrates, the high glycemic index carbohydrates, have issues with leaky gut, almost everyone. And so we can see so powerfully what's happening on the outside visibly if we have those before and after pictures. And I have to just reiterate what you said earlier. Imagine what's happening on the inside, what we can't see when we give our bodies these youthful compounds that they know right what to do with them. And they will always, you might comment on this, I think our body is infinite in its wisdom to utilize the collagen and the hyaluronic acid, the chondroitin, where it needs it most.
Where it needs to go. And also, our studies show that your microcirculation is increased. And I have a patient who had a stroke on the same night that 2 other people in the emergency room had the exact same stroke, and they did not fare as well as she did. She had been on liquid BioCell for post-polio symptoms that she had for many years. And she did much better than people who didn't. And I'm not saying that this was the reason, but we are clinically shown to increase the microcirculation throughout your body. So there you go.
Yes, 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 yes. Another question here. Is it safe? Is liquid BioCell consumption beneficial for asthmatic patients? Does it impact the lungs? Does it impact breathing?
You know what, that's a medical issue and I can't speak to that. So you can infer what you've learned from what I told you, but I can't speak to that. I'm sorry. You need to speak to your medical professional.
Yeah. It's when we talk about something, you know, curing or whatever.
Yeah.
But yes,
I will tell you it's safe to take if you have asthma from my point of view. But again, you need to speak to your medical professional about that. I will not any kind of advice about anything medical, unfortunately.
And I would just add in, if you remember some of the things that have been shared about how it's beneficial for all soft tissue.
Yes.
You can infer some things as well. Let me see if that's another one. So it's paralysis, somebody that has difficulty in movement. This is kind of a no-brainer, but let me pass it to you anyway. Can it, I know she's going to be reluctant. I know she's going to be reluctant to answer because we're putting medical conditions out there. Let me say this. And I guess it depends on what the source of the paralysis is. We just talked about the improved circulation, right? And
what it does to muscles and ligaments and tendons, and with physical therapy and stretching, it should make your muscles a little bit more resilient.
Pliable.
Okay. because it does increase your hyaluronic acid levels. And do you know that your muscles are 75% water, which is hyaluronic acid?
And that your brain is 90%.
Okay,
Water,
your lungs
which is
are,
right.
yeah,
Which is
lungs are,
hyaluronic acid. We need to be replacing this, right? On a regular.
absolutely, we certainly do, because we lose it from birth until the day we die, and we have a way to stop losing that.
If somebody's on a limited budget, can they get benefit from taking it once a day?
Yes, yes, you will definitely have benefits from taking it once a day. And it will take you longer to see results, but it's not without merit. And I don't know if they have the same sharing program that we do, where you share the love, you actually help other people and get credits in your account. I can't speak to that for your country, but there are other ways of helping you support and get your product for at a lesser price.
Yes, 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 exactly. Now, one more question. How young can somebody start taking this? And let me add a caveat to that. If somebody is, for example, a high school athlete that is, Stephanie says she successfully gave it to her son, who is a high school athlete, they are breaking down their body at a stronger pace than their peers. Can it be beneficial?
Yes.
Yeah.
Yes.
Jump in.
A million times. Yes. My boys started taking it, I think, when they were about 14, 15 years old. That's how old they were when I started taking this. And whenever they have any kind of issues, even without, I'm like, you need to just be taking this no matter what, just take it. And my kids come asking for it. So yes, you can take it. Even if you have younger children, talk to a pediatrician, maybe half the amount of normal, but certainly in high school. And if you're an athlete, 100%, their bodies crave this. Yeah. Yeah. Any other questions, guys? How amazing has this been? I've enjoyed it. I start thinking that I know almost all there is to know about this product. And then I listen to you and I'm like, oh my gosh, I just learned so much. I've got a whole page of notes here, and anyone want to comment, jump in? I think that does it for our questions. Well, thank you so much for the opportunity. And I hope to be able to come and visit and have this conversation in person with you guys. And
thank you.
Build a team and